Hi, my name's Nick Parker and I'm part of the integrated care practice at Soctium Advisory. We recently hosted a series of virtual events looking at building successful integrated care systems. These events focused on a number of key interrelated themes of relevance to those supporting the development of ICSs. In these snippets, we look at digital disruption, unleashing the power of data, and some of the key aspects in leading partnerships across a place. As well as contributions from our own experts, this selection features a number of guest speakers from across the sector, including Monica Jones, Kate Walker, and Connor Burke. The full recordings are available to view, so to see more of those, or if you want to discuss further anything that you've seen, please contact us via our website.
And, you know, whenever you embark on any of these sorts of initiatives, you kind of think, you know, what is the core exam question? What is the core thing that we're trying to do here? Well, it's the opportunity to change the health and care experience of individuals at a local and place level. That's really what it boils down to. How can we galvanize the developments in property and the way that estates thinking and intelligent building design has come together? How can we harness what's been happening in terms of integrated local workforce with all the issues that we'll be aware of around capacity gaps and trying to land joined up services with locality teams and neighborhoods? And then the third area, so the third corner of the triangle around digitally integrated care services, which is the bit I'll place a bit of time on today. You know, what we've learned as a sector is that, you know, the dysfunctional aspects of us accessing services locally about breakages in general. They're about breakages in data, breakages in communications between various services, an inability in many cases for us to do things for ourselves, and for those unable to actually care for themselves, to have someone coordinate once without repetition and rework at what's going on. So if you look at that as the kind of core problem statements that we're trying to solve, I try and reflect on how hubs coming together with these three sets of enablers will make life different going forward. So again, here's a few factors. What do I mean by digitally disruptive care model? This is about changing local services and how we consume them. So the first one, care outcomes. You know, we've talked as an industry about outcome-based commissioning, to my knowledge, for 20 years. You know, it's a recognised need. Andy picked up on public health and their role in all of this. You know, if you boil down their primary purpose in life, it's around disease management at a regional, local level, and also how to deal with long-term conditions. Now, what that has done, and this is where the technology pieces come in, is it's spawned many new digital innovations around prevention. So we can see, you know, different screening methods for bowel, breast. We can see the ability to consult online, monitoring solutions. As an organisation, there's many, but this one I'm familiar with, Healthy.io, who are doing lots of home-based tech around COPD, blood analysis, UTI, etc. So care outcomes are starting to be integrated, not just from a treatment point of view, but with prevention as well. And that's the crucial bit here. It's bridging treatment with prevention, and that will give us a different experience. Now, as I say, digital enabled working, we've all recognized that. For a long time, we thought that the deployment of these technologies was going to be, you know, going to take us a long time and it's going to be difficult. Well, guess what? In a few weeks and months, we started digitalizing home working. We started doing remote consultations on platforms. Yes, there were hiccups, but we got through those. We've now got more sophisticated things going on, virtual hospital and care ward rounds by videos. This is empowering individuals to do things very differently. This is a disruptive care model.
What we've been doing recently, obviously, like everybody else, you know, we've been responding to the global pandemic. And last year we did some pretty rapid sort of analytics when we saw sort of during the first lockdown this massive drop off in terms of 2-week wait referrals. About 70% of cancer patients were not getting a referral from primary care, and also attendance for chemotherapy, radiotherapy, and other other therapies was down by about 40%. And you can see the drop off here in each of those areas. So we pulled together really as a call to action, not only to the government, but the CMOs across all 4 nations, really saying, you know, if this continues, then the impact in terms of excess deaths of people who are affected by COVID, who have cancer, could result in between 7,000 and 18,000 additional deaths. What we've now been doing is working with NHS Digital, with the National Trusted Research Environment, the TRE, which brings together the standard data sets, such as HARES, SUS, mortality prescribing data, with all of the COVID data sets, the Pillar 1, Pillar 2, and the vaccination data. That's then linked in their environment, the DAE, once again using Privitar tools, a very similar approach to what we've done regionally in Yorkshire and Humber. And we've got essentially access to pseudonymized data for more than 50 million patients in England, 12 billion rows of data, in order to be able to do some very detailed sort of analytics and research, to prove whether the modelling from last year was right, but we're also seeing missing diagnosis in the system. And as we all know, that if somebody presents at a later stage with cancer, then the outcomes are far, far worse. We reckon in Leeds alone, there's about 1,500 missing people, and that would extrapolate up to about 85,000 missing people in the system. So that's the effect of COVID on cancer. So some really important work that we're doing there.
Do you think it's time that, particularly when you're looking across wider communities like ICSs, that actually information strategies could be useful documents?
Yeah, I think it's very important. You know, as part of the build-up for describing both the STPs and then the migration to ICSs, we all had to produce a digital roadmap. And underpinning that is, you know, a really good sort of information strategy. And I know that it's a subject very close to and dear to your heart, sort of, Gary. But I think you know, it is something that we absolutely must sort of embrace in terms of sort of knowing where we want to get to, what the principles are, what our approach is in terms of of both our strategic sort of direction, but also how we operationalize that. So I think it is very important. I think as data becomes more and more part of our everyday lives, and you know, I think everybody has recognized that as part of the COVID pandemic over the last sort of 18 months. Even my 83-year-old mum, you know, could actually sort of quote you the daily briefings, the COVID briefings, you know, in terms of, you know, what the rates were, what the hospitalization was, what the R number was. You know, people, it's in common parlance now to actually expect real-time data and actually meaningful data. Then I think it's beholden upon all of us to be able to describe how we are going to get to a better place, and what the component parts are of that.
Okay, but an up-and-coming data generator to feed your ever-growing data lake. So I wanted to talk a little bit about unleashing tech data, so technology-enabled care data. And as you can see from the slide, I'm going to talk through a little story through just this one slide, but we can see that primary care and acute are both commission and provide tech data and tech devices rather, as do adult social care and children's services, who primarily do a lot of commissioning around these sort of services and devices to support people and their independence in their home. Most of the provision of this is certainly from a social care perspective, is within the third sector, although sometimes it's elsewhere within the local authority, but not necessarily sitting in adult social care, where it tends to be. But finally, and more interestingly, kind of citizens and patients. So when someone presents needing support or help, often they've already got some of this infrastructure already in their homes, be it a smartphone or be it maybe a sensor that either themselves or extended family have suggested would be a good idea. But we've seen the growth of use of these technologies through the COVID pandemic. And certainly we've seen a growth of the kind of devices that can enable people to be supported remotely through conversation assessment and to some extent through service delivery. So as this grows and as the kind of pressure on resources in terms of the actual people being available to deliver support and care, either in a kind of clinical setting or at home, this area is just going to grow and grow and grow. So the amount of data that's going to be created is going to grow and grow. But what can we actually do with this data? At the moment, it's pretty siloed. I don't think it's very accessible to what you might call your mainstream systems. So we need to be able to funnel this data into a platform and then use it in a range of ways, which I've kind of describing here. So, and although current sort of systems, a lot of systems in social care are alarm based and just do an event one-way trigger. Actually, we're starting to see platforms emerging in the market now that actually are able to, yes, manage with those triggers, but actually push reminders and nudges and messages to people to remind them to drink if there's some hot weather coming along, or to keep warm if there's a cold snap coming along, etc. But actually there's starting to be two-way alerting and responding, and this data can support that. It can also support pathway and case management, so where we're supporting individuals, and that can be done via a shared care record, which Monica's talked about earlier, and that can move down into review work that professionals and practitioners are doing, and also it can help where someone's in a discharge setting. So if a discharge team can actually see that this person's got some technology-enabled care in their home, that might speed up their discharge because there's already some infrastructure in there that they can take advantage of, and also that continues that data feed. Obviously, the data can be there to support your performance management. That's, you know, at the operational level, but also I think more interestingly, it can be used to kind of support your service improvement and developing your services so that they're more responsive and they meet the needs of the people that you're serving. And then finally, obviously, all that analytical data, which Monica's spoken an awful lot about, and the use of artificial intelligence and machine learning and the like to kind of generate those insights that you need across your communities about your services, and more generally about impact of services across your community. I think there's one more clip, please, Bobby. Thank you. So, and in some ways, it sounds quite straightforward what I've just said. We just commission some devices, we capture the data and we use it. But actually, unfortunately, the world isn't quite that straightforward. And again, Monica had already alluded to this around things like standards and information governance. So there are so many devices out there. There aren't any. There are numbers of standards as well. So it's quite difficult to sometimes to bring that data in and to make those devices interoperable with these platforms that can gather the data and then make use of it. And then something that's emerging as an issue, I think, particularly where we're looking at citizens and patients maybe using their own individual devices, is actually digital inclusion. People may not be able to afford those devices or afford those a broadband or digital connections at home. And how do we actually do that? I think if there's an assumption that everybody's got access to the internet and access to digital devices and can confidently use them, the evidence suggests that's not the case, and significant numbers of people are excluded from accessing services and information using those channels, and that's something I think that we're going to see more and more about going forward.
As I said, I've spent some time in thinking about the barriers, and there's 4 major barriers to digital transformation at scale and pace, and you'll recognise these from all of your environments, whether it's silos of technology, people, data and the like, whether it's your capacity and capability, both within your own organisations, but also in the vendor market and the partner market. Misaligned levers and penalties sometimes sadly mean we hit the target but miss the point. And we've often challenged with tribalism and protectionism, you know, and partnership is about working together and making the best of the assets that you have. And fundamentally, the things that break down those barriers are trust. It's about having trust with partners to be able to break down those knotty problems, and building that trust takes time. And there's loads of examples of where partnership working have broken down those barriers. But a few messages from my point of view. I think it's people, relationships and partnerships before tech. I think it's about having vision and guiding principles and guardrails rather than the detailed plan of how we build a rocket to get to the moon. We may not be going to the moon. Collective accountability, values and principles, and remembering what binds us, what we have in common rather than our differences. Remembering that change happens at the circle of trust. And of course, if you want change to be systemic, your trust needs to be systemic. We've tried to embed continuous learning innovation. We've tried to catch people doing things right. We know that useful and usable data and technologies are critical at every level to enable system working, to build that trust, to build those relationships, and to make sure that the resources are placed where they're needed most. Data fluidity, literacy, and those adaptable tools mean we can move people around to better serve the 1 million people in Suffolk and North East Essex. And we know that timely information and actionable insight improve outcomes for people. I think principally we focus on where we can make a difference, where it matters most. And we want to work with partners to address that.
Because place is at the heart of everything, and it's a particularly area that I'm passionate about in relation to making a real difference to local people. My sense is that the whole concept of place, we all mean very different things about it, and probably the most important bit of place is that we all need to have a common definition. This is my definition I worked up a while ago when I was working with a local government colleague, and we spent some time really thinking about what is the power of place and how do we unlock its potential. It isn't just about statutory public services. It isn't just about the infrastructure of connecting different bits of the NHS or even, for that matter, local government, but it is about absolutely involving people in the local community as equals, not as clients or customers, as key partners, and also thinking about the opportunities of working with business and commercial support organisations, because all of this is about improving the quality of life and the outcomes for local people. And I guess that kind of vision hasn't yet, in my mind, been fully accepted and agreed within the new philosophy and within the new reforms. Often it appears to me to be a collective of public sector type organisations thinking about how they deliver their services rather than how they deliver quality of life improvement outcomes.
But I think what really came about in that is about people and not process, about having that common purpose and that commitment to really listen to people, and listen to their lived experience and take that into consideration and make that part of our systems thinking, and engendering that trust actually with those individuals by demonstrating that you have listened. I think Kate and Connor both mentioned around actually we've said we've listened in the past, but maybe that's not always happened. And then that came through really strong, and that common purpose about keeping in mind the why are we doing this, and what's really going to make the difference to people's lives. And there's a couple of really good tips in there, I thought, around common language in particular. That's something that I hadn't really thought about myself, Connor, about how these different organisations come from very different places, and now we're coming together in a single place and need to talk a common language. I certainly see that as challenges within some of the delivery of programmes and projects that I do within Socketsham Advisory. We find with a lot of our customers, we've got partners working together. Some of those are providers, some of those are different organisations from different sectors. And actually, one of the biggest barriers to them collaborating and getting started on things is that common language. I thought that was a really good tip.
And I think the overriding theme from today is about the importance of the why and the importance of people. And I think that is a fantastic way, I think, for us to perhaps round this up.